Promising COVID-19 vaccines are on the way, but will they quickly reach some of the people who need them the most? Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, senior writer with AHA. It's vital that a safe and effective vaccine, when ready, reaches the racial and ethnic groups that have been disproportionately devastated by the virus. In this podcast, Nancy Foster speaks with Sonia Perez and Clint Odom about best practices that hospitals and health systems can use to reach Black, LatinX, and underserved communities, and the most effective strategies for COVID-19 vaccine distribution.
Today, I'm excited to be joined by Sonia Perez from UnidosUS and Clint Odom from the National Urban League to discuss the timely topic of COVID-19 vaccination. Given the latest news from Pfizer and Moderna regarding the effectiveness of their COVID-19 vaccines, we will explore challenges, best practices, and key insights for equitable distribution. Both UnidosUS and the National Urban League have worked closely with AHA to advance health equity, diversity, and inclusion within communities across the U.S. So thank you both for being here. Let me start by asking both of you a question. We want to learn more about the National Urban League and UnidosUS and the work that you are leading over the last several months in response to the COVID-19 pandemic. Sonia, could we start with you and learn a little bit more about UnidosUS?
Sure, Nancy, and thank you for this invitation. It's great to also work so closely with AHA and with NUL. We've been partners on a lot of work, so looking forward to the conversation. So let me tell you a little about UnidosUS. We're the largest Latino civil rights and advocacy organization in the country. Right now, almost 1 in 5 Americans is Hispanic, and 1/4 of all American children are Latino. So whether it's California, Kansas, North Carolina, right, across the country, Latinos represent our future leaders, our workers, and our taxpayers. And so UnidosUS has really been involved over 5 decades, ensuring that we have, equality of opportunity so that Latinos have the ability to complete college, move up the economic ladder, have access to health information and health care. And we work on programs, on policy, and with a network of almost 300 community-based organizations in the US and in Puerto Rico. So, we know in terms of health that health is our most important asset, and it's influenced by many factors. And the pandemic has really exposed and worsened issues, social and economic inequality for Latinos. Latinos have been hit exceptionally hard. We're 18% of the total US population, but make up 27% of COVID cases nationwide and 16% of deaths. So it's an issue that we have been very focused on since March. And, knowing that Latinos are on the front lines, making contributions, vital contributions from Latino workers, everything from helping keep America fed, keeping the economy moving. So if you go from farm workers to meat processing plants to those stocking shelves and delivering food, we're right there. Some of the most vulnerable getting sick and dying. And that's why for us, our work on multiple issues has really been the foundation for how we address what's happening on COVID.
Thanks. Thanks so much for those comments and really important points about equity as an underlying factor going forward. Clint, let me turn to you and ask about the work that NUL is doing, please.
Well, first, I want to say thank you to AHA for inviting us, and certainly the opportunity to be with our friends at UnidosUS. It's just always a pleasure. The National Urban League is a 110-year-old civil rights and economic empowerment organization. We serve about 2 million people through direct programming each year. in 36 states, including the District of Columbia. And we are just about everywhere where population exceeds 30% for African American and Latino communities. The COVID pandemic has struck our community extremely hard. We've heard the statistics about fatalities and incidents of COVID, and they certainly are correct. Of the 250,000 people who have died in this country from COVID, a little more than half of those people have been Black and Latino. So clearly this pandemic is having an outsized impact on our community. In this moment, we have been trying to lead in thoughts, words, and deeds. With respect to thought leadership, we have been out there with our friends at UnidosUS calling for equity in testing and data collection around this pandemic so that we can see where the problems are and properly direct resources to the problem. We've also testified before Congress on various approaches to the pandemic, the consequences for inaction, as well as what should be done. In terms of deeds, some of our affiliate locations throughout the United States have served as COVID testing sites, and we have recently informed the transition team of our willingness to let affiliate sites across the country be used for vaccinations. And then finally, in words, we've been raising awareness of the importance of clinical trial participation for people of color and exploring what that means for vaccine hesitancy in particular. And I'm sure we'll get to this, but there's a high rate of hesitancy among communities of color for taking vaccines and well-placed hesitancy. We've also been publishing on a daily basis coronavirus updates, both on racial and gender and geographical slices of data, and working with our local affiliates in their advocacy efforts on the local health side of the equation. So that's really it.
Critically important points that you make, Clint, and I was so heartened by the communities of color as we're beginning to see the data from both the Pfizer and the Moderna trials, that there was a robust participation by people of color in those trials, those phase 3 trials that can help inform the work as we begin to think about vaccine distribution. So great job that you've done. Sonia, let me come back to you and ask about the Latinx community. The CDC reports that the Latinx community, which makes up over 18% of the population, accounts for 26% of the COVID-19 related deaths. How are your members overcoming these challenges, and what advice would you share about how hospitals and health systems can work to strengthen relationships within the Latinx community to help address this problem?
Well, in the absence of a coordinated national response to COVID, I think all of our communities have had to mobilize and step in to lead. And within UnidosUS, we, immediately as we were seeing the effects of the pandemic and the development of it in early April, established a fund, Esperanza Hope Fund, to work on 3 areas. One was on public health education, understanding that, again, we needed to really get messaging out to the community. So if you follow us on social media or look at UnidosUS.org, we really have become the go-to resource, with accurate information. It's changing daily, similar to what Clint talked about in terms of what NUL is doing, publishing data daily. And also having toolkits, information in English and in Spanish to help Latino families protect themselves and their children, right? We've also, part of this fund has been to provide emergency assistance to our affiliate network. So to date, we've awarded $1.5 million to over 60 affiliates for emergency relief. Many of them were doing direct services on different issues, education, health, et cetera, and had to quickly pivot to respond to the food insecurity issues in their community. As Clint mentioned, testing, right, learning how to do telehealth and really providing that kind of response that the community needed. So So these funds, this cash assistance and support and grants to these organizations allowed them to cover some of these expenses and also importantly learn how to navigate this new environment. Everyone's working remotely. These organizations have been amazing leaders in their communities, and so have really pivoted to providing, to integrating technology into their work to address these issues. And we've also done a national advocacy work leading a response for the Latino community. 5.5 million people, including Latino citizens, legal residents, and mixed status families with U.S. citizen children were left out of federal stimulus response. And that weakens and hurts all of our communities. So part of what we've been doing is this kind of advocacy, both at the national level to talk about the impact of COVID, but also messaging to protect communities. And that includes messaging around, certainly around what we're seeing now with the vaccine. We've established that trust with the community, so coming to us for that information and to community health workers has been critical to both to dismantling misinformation, but also to providing simple and clear health information and guidance for the community. I would say that, the response in terms of community information and community partnerships, right, is where AHA members come in. And I would invite them to go to our website, UnidosUS.org, and look at our affiliate map. We have community-based organizations in 37 states, in Washington, D.C., in Puerto Rico. And partnerships are really going to be, local partnerships are going to be really critical as we're talking about vaccine information, vaccine uptake, and it does require sustained engagement and participation of local communities to ensure that everyone is protected. So, our communities are part of the solution, and I think these kinds of partnerships can be super helpful at the moment. And we have examples that we can look to. For instance, one of our affiliates in Tacoma Park, Maryland, Casa de Maryland, has used their community health workers, promotoras, to educate and recruit individuals to enroll in clinical trials. Another affiliate, Esperanza Health Center in Chicago, teamed up with Rush University Medical Center to provide Spanish language information to communities about how trials work and what to expect in participation in trials. So these kinds of steps are really important to foster that kind of relationship at the local level. And that's what's going to be really critical as we move into the vaccine uptake phase.
Thank you. That's incredibly helpful to know about the map. So agree with you that local engagement will be very useful for our members to foster with your colleagues. May I also ask, is it all right if our members link to the information that's on your website to help address issues in their communities and to help inform the communities that they serve?
Yes, absolutely. And I would also encourage to come both to UnidosUS and to the affiliate. I think the more we know about these partnerships, we can also amplify their impact, right? It isn't, we do the one-on-one work in specific states and cities, but it's also when we aggregate the results of all of this work, leverage this kind of expertise through peer exchanges, and we can really amplify the collective power if we're doing it all together. So absolutely go to the website, but also keep us connected and informed, and we can facilitate some of those local relationships.
Wonderful. What a great offer. Thank you so much. And Clint, I'm going to come back to you. And first of all, I also want to ask about whether it's all right if our members link to your website and the data that you're supplying to both inform their own efforts and to make the information more readily available to folks in their communities. But then would you also talk to us a little bit about the fact that earlier this month, the APM Research Lab reported that Black, Indigenous, and Latinx Americans all have COVID death rates of at least triple white Americans. What key insights can you share about how hospitals and health systems can address perceptions around the COVID vaccine and how we can make better connections to overcome these barriers to equitable care?
Thanks for the question. It's a great one because We know why there are higher rates of COVID in our communities. It's a complex issue, but we know the factors. Our workers are more likely to be on the front lines of this pandemic with a higher exposure to the virus. Our living quarters, which can often be multi-generational, help facilitate the spread of the virus between younger people, older people, and seniors. These are huge factors that contribute to it. So our health delivery systems need to be aware of this risk. But I would say, in terms of insights, the first one is that vaccine hesitancy is born of history. It is not a superstition. It's not something that's made up. There is a real history of why communities of color, and African Americans in particular, are hesitant to take vaccines. Um, Secondly, I think we address this hesitancy with transparency and with a spirit of equity. I think if you let people know what's going on, you introduce them to the risks and to the opportunities, you will see higher participation and a demystification of the process. Um, the way we execute on improved vaccinations should have been the way that we executed in testing. We didn't prioritize testing in this country. I think we made it available to whoever could get it. If you were able to pay for it, or if the vaccines were close to where you lived, you got it. That just can't be the way we execute on a vaccination strategy. Um, there must be more symmetry and fairness and equity in the way we distribute the vaccines. And we have to prioritize, frankly, based on proximity to the disease and populations with the highest mortality rates. That is not yet a widely held strategy. There is no national strategy of which to speak, but I hope when one is developed, that will be a centerpiece of the strategy. For example, Native people have the highest fatality rate of any uh, other group in the United States. Tribal lands must be a priority for vaccination and testing. So we hope that we will open our eyes and go to where the data tells us to go. And then finally, I'd say, as in terms of insights, we have to depoliticize vaccination. We can't use it as a political win or a political reward for getting it done fast and getting it done, um, you know, in a neighborhood near you. This is not how the FDA approval process works. We have to take our time and make sure that we do it correctly and that we're not rushing toward a date or skipping steps in the process. If we approach it with these three goals in mind, I think we'll be a lot better off as a nation.
Oh, thanks for those comments. That's so insightful. May I come back and just ask about linking to your data? Is that doable for our membership as well?
Absolutely. Our website, nul.org, has lots of good information and some toolkits that we've provided for our local affiliates. We've also provided, and I'll make sure that I share with you expressly, some of the testimony we've delivered before Congress and recommendations on how we should approach a testing and vaccine strategy so that your listeners can have access to it if it's not readily apparent on the first few clicks on the website. Happy to give that information to you.
That's great, because to your point, the fact that hesitancy is born of history and that we can overcome it with information. I think if our members can reach out and learn from the information both of your organizations are providing, it will help them as they move forward to try and address all of their communities with fairness and equity. And Clint, thanks so much for sharing your insights into how to best distribute the COVID-19 vaccine. Sonia, could I ask you to address that question of how to best distribute the vaccine to communities of color?
Yes, sure. And I'd like to build on what Clint mentioned. For us at UnidosUS, our recommendation is to start with a focus on equity, right? It's an equitable approach on all fronts, from inclusion of communities of color in trials to the distribution and to the uptake. So I think it's really going to be important to have that transparency in the data, understanding that our communities, when you provide information, when you provide scientific information and provide it in a way that's clear, transparent, and that a way that a layperson can fully understand, communities will take the information and make the right decisions for themselves and their communities. So it's going to be really important to do that, to include all these different voices, to share what we know about the process of the development of this vaccine. It's very promising data from Pfizer and Moderna, but it's also really fast. It's been a fast pace, and it is also quite complicated. So I think we have to find the right trusted messengers to help our communities understand the science and then take action. I would also say that from a distribution perspective, access to the vaccine is going to be really important, right? We have to bring it to the communities where the communities are and eliminate those barriers of, if you have to take transportation to get somewhere where it's really far, hours of service are not conducive for people who are working perhaps multiple jobs, then, that is going to be a barrier. So we need to think about access. Of course, education and information campaigns, giving clear, plain, actionable information, and taking cultural relevance into account, right? Every community may need a message that's adapted differently to reach the community, to be culturally relevant. And then, of course, dedicate resources to community hospitals, to community organizations. So we have a network of providers that are working in a coordinated way to ensure that the vaccine gets to where it needs to go. And a couple of other things to consider. Costs, we're all really concerned about that as a factor. If it's too prohibitive, then people will not obtain the vaccine or treatment. And finally, I think for different communities, and speaking to the point about, historically, communities of color have been left out of these conversations or in the planning process, right? Understanding, for example, for the Latino community, how is personal information going to be used? Is their privacy being respected? Is it going to be confidential? Because we don't want to deter individuals and families from accessing the vaccine if they don't clearly understand, how the process is going to work.
That your final point there about data being protected reminds me that with this vaccine, we are necessarily going to have to collect information about individuals, including a way to contact them in order to remind them that it is time to come back for their second dose, since virtually all of the vaccines require a second dose. It's so incredibly important, as you've said, to really communicate effectively about why we're collecting it and how we'll protect that data. Sonia, any other advice you have for us in that regard?
Again, I think it is about education, taking the time to provide that information. When we have concerted communication campaigns, when we know how to reach communities, we know what works in terms of messaging, and we know that there are community-based organizations and community health partners are leaders, community health workers are leaders and trusted partners, and they have to be part of the solution in terms of executing on getting a vaccine out there. So it is through these messengers and through these messages that are culturally relevant and appropriate to the different communities that we work in that we're going to have more success in ensuring that people have access to the vaccine.
Clint, let me come back to you and just ask if you have any further advice for folks in hospitals and health systems about effective communication to communities, or other strategies they might employ to ensure that that we're addressing the concerns that people have as they think about whether or not to get a vaccine.
When Sonia says it all, what you do is co-sign what Sonia just said, and I couldn't give a stronger endorsement to everything she said. Uh, the cultural competency piece is so important. Having a trusted messenger is so important. Uh, if your goal is to, in fact, vaccinate uh, as many people as possible and go to where the fire is burning. If you are indifferent to that point, and if you're interested in seeing the disease be around much longer than it needs to be, along with the associated economic destruction and loss of life and loss of education, well, then you keep doing it the way you're doing it, which seems to be haphazard and not prioritized and certainly not equitable. So I endorse what she said, 100%.
What Sonia said makes an inordinate amount of sense, and I appreciate both of you sharing that message. In August of 2020, the Gallup poll reported that 1 in 3 Americans will not get a COVID-19 vaccine. What do you believe are some of the primary drivers behind this statistic? And what do you believe are good strategies for hospitals and health systems to overcome this belief within their communities? Clint, let's start with you, please.
Sure. Well, Blacks have been first to participate in unknowing experiments like Tuskegee. And of course, we all know about Henrietta Lacks. But yet we're often the last to receive life-saving therapeutics and vaccines and even things like personal protective equipment. So I think we've got to flip the order in which we are doing things. We have to recruit Black and Latino people into these clinical trials to make sure that the products that are created actually work in our community and with our unique physiology and chemistry. And we also have to prioritize um, giving life-saving therapeutics and vaccines to people of color because that's how you get ahead of the disease.
Thank you. Sonia, anything you would like to add to that?
Of course, yes, we need to look at the history and understand and respond to that, as Clint says, because that is the basis for how we're going to start to change how we go forward. I also think, again, that engaging Latinos and other communities of color from the very beginning, right? From from giving them information, from engaging them in the trials, et cetera, and also understanding and sharing, communicating, the information. What are the long-term effects, or what do we know about the effects of a vaccine at the moment? Because there are a lot of concerns from our own polling with the Latino community. That's one of the one of the concerns that they have raised about what are going to be some of the side effects of this. Is it dangerous? The other, I would say, is that we do need to respond to the moment, and unfortunately really need to break down a lot of the confusion and chaos that has been sown over the last couple of years. And the Latino community is not fully confident that they can even access healthcare and preventive services, given the anti-immigrant climate, anti-Latino climate that's been fostered at the national level and by policies. So we do need to address those factors, because that's part of this, the barriers to why people are not going to immediately accept a vaccine. So we got to do a little bit of work and understand that. And I think we also have to be quite intentional from the hospitals and health systems perspective. It's not just translating information into Spanish. In some communities that's not the primary language. So you want to ensure that your community. And I would end by saying that, our health as a country, America's health and our future is tied to the well-being of communities of color, right? We are a third or more of the population. We're a young population. We are going to be future of the country, and we can establish a better future by focusing on equity, by focusing on inclusion of all of these voices, and it's going to result in a healthier and stronger future, not just for our communities, but for the country as a whole.
I just want to thank both of you. The information you've provided, the attitude and help that you've offered, and to our members as we move forward is so incredibly useful. I will reflect to you that everything I hear from our membership is they want to ensure that as they move the vaccines out, as they move treatments out, it is done so in a way that is fair and equitable and recognizes the fact that this disease has been particularly hard on persons of color. So acting on that desire will be helped by the information that you have provided today and by the work that we can do together and with your local entities, your local communities. So thank you again for being part of this. Really appreciate your time and efforts and look forward to continuing to work with you as we go forward.
Absolutely.
That was
Thank you.
good. Thank you again for the invitation.